One in this video we are going to see what is mean by pharmaceutical care, its introduction, definition, and principles and orders of the pharmaceutical care. First one is introduction. We note that health is defined as a physical, mental, and social well-being of an individual. Medicines are nowadays and later world, medicines are used to treat various disorders. Medicines, if used appropriately, means it will relieve the patient's symptoms and cause harm to the individual health if inappropriately used, and increases the therapy related expenditure to the patients and to the government. If we use the medicine appropriately, means our diseases will get cured. If the medicines are not used properly, if patient use these medicines inappropriately, means it will increase the symptoms and can cause or lead to harmful effects. Well, while pharmacists are offering professional services in community, hospital, and clinical settings to improve the knowledge of the patients about the pharmaceutical requirements, by virtue of their knowledge in the area of the therapeutics and clinical pharmacy, pharmacists are able to identify the all drug related problems and provide suitable solutions to the problems to patients, and can counsel or educate the patients about the medications use, safe and effective use of medications, and appropriate diet and lifestyle changes to maximize the therapeutic outcome. Then pharmaceutical public health has been defined as the applications of the pharmaceutical knowledge, skills, and resources to prevent diseases and prolong the life through promoting, protecting, and improving the health of the society in an organized way. Pharmaceutical public health addresses the health related issue at a societal level, whereas pharmaceutical care addresses the health related issues at a individual level. First, in definition, the word pharmaceutical care was first coined by Michael et al. In 1975 and defined as the care that is given to patient requires and receives, which assures safe and rational drug use. First of all, what is meant by pharmaceutical care means educating the patients about the safe and effective usage of the medications. Since 1975, this definition underwent various modifications. In 1990, Douglas C. Helper and Linda M. Strand gave a new definition to pharmaceutical care, which is globally accepted. Helper and Strand defined pharmaceutical care as a responsible provision of drug therapy for the purpose of achieving definite outcomes that improves the patient quality of life. This definition was considered to be more realistic, goal-oriented, and particularly for chronic diseases such as diabetes, where maintenance of quality of life is an important consideration. In 1998, International Pharmaceutical Federation adopted this definition. Here, the pharmaceutical care means responsible provision of drug therapy for the purpose of using. What is the purpose of using the medication means to reduce the symptoms and to improve their quality of life and to cure the diseases. So, the pharmaceutical care means achieving these goals by properly and safely, effectively using the medication which was prescribed by a prescriber. Then the practice of pharmaceutical care is an new concept. In contrast to the present practices of the pharmacist, in routine practice, pharmacists dispense the medications against the prescription. But in pharmaceutical care practice, pharmacists analyze the prescription, identify the drug-related problems, and resolve the same in consultation with the prescriber and the patient. The goal of the pharmacist in pharmaceutical care is to meet the patient needs for appropriateness, effective, safe, and convenient drug therapy in terms of desired therapeutic outcomes and improved health-related quality of life. Yes. First of all, pharmaceutical care means it is not dispensing the medication by the pharmacist, whatever medication by the pharmacist. It means analyzing the prescription properly and finding any drug related problems is there in the prescription. If there is any drug related problem means have to check it and inform the consultant and curing the drug related problem by changing the medications or doses and giving a safe and effective medications to the patient. This is considered as a pharmaceutical care to improve the effective, safe, and convenient drug given to the patient to treat the diseases and improving the therapeutic outcomes of the patient. Next is here we seen the introduction, then definition. Now we are going into the principles of practice for pharmaceutical care. Pharmaceutical care is a patient-centered, outcomes-oriented pharmacy practice that requires the pharmacist to work in consent with the patient and the patient's other healthcare providers to promote health, to prevent disease, and to assess, monitor, initiate, and modify medication used to assure that drug therapy regimens are safe and effective. Yes, pharmaceutical care means to promote the health of the patient, to prevent their diseases, and to monitor, assess, initiate, and modify the medication. If there is any error in the medications, there is any wrong in the medications means to modify the medication. We have the responsibility to modify the medications and giving a safe and effective medications to the patient. The goal of the pharmaceutical care is to optimize the patient health-related quality of life and achieve positive clinical outcomes within realistic economic expenditure. To achieve this goal, the following must be accomplished. Our main goal is to improve the quality of the life of the patient and achieving the positive clinical outcome. Positive clinical outcome means curing the diseases. To achieve these goals, what are the following steps we have to be followed means, first one is a provisional relationship must be established and maintained. Interaction between the pharmacist and the patient. In pharmaceutical care, the main role is taken by the pharmacist only. So interaction has to be done between the pharmacist and the patient must occur to assure their relationship based upon caring, trust, open communication, cooperation, and mutual decision making is established and maintained. We should maintain the proper communication, proper caring. We should build, as a pharmacist, we should build trust with the patients. Then only they will openly communicate everything with us. So we have to establish a trust, caring, so that we can improve the communication between the patient and we can take a mutual decision. If we know that as a pharmacist, we will know that this medications will be safe. This medication have more side effects, and so if we build a proper communication, trust with the patient, we can suggest this medication will be safe for you. Then if no communication, no trust is built, means we can suggest but they will not accept. So in proper communication we can suggest, and the patients will also accept these medications. So proper communication has to be, proper relationship has to be built between a patient and a pharmacist. In this relationship, the pharmacist holds the patient's welfare paramount, maintains an appropriate attitude of caring for the patient's welfare, and uses all his or her professional knowledge and skills on the patient's behalf. Next is, patient-specific medical information must be collected, organized, recorded, and maintained. First, we have to build a proper communication, proper relationship between the pharmacist and the patient has to be built. Next one is, before we starting in this communication, we have to collect all the uh, all the information, medical related information has to be collected, organized, recorded, and maintained. Pharmacist, first of all, pharmacist should collect or generate subject to objective information regarding the patient general health and activity status, past medical history, medication history, social history, diet and exercise history, history of present illness and economic situation, financial and insurance status. First of all, what are the medical information has to be collected by the pharmacist? Means subjective information. Subjective means name, age, sex, weight, height, BMI. These are the basic subjective informations. Patient medical history, present illness history. These are the normal subjective informations. Objective informations means vital signs, social history. These are come under the objective informations. Fast medical history means if the patient has any diabetic past, how many years of this diabetic is going on, and hypertension patient means whether the patient is taking any medications, diabetic patient is taking any medications, whether he was skipping the medications. All the detail has to be asked to the patient by proper communication. Next, we can ask about the is medication history. Medication history means whether they are taking any kind of medication, prescribed medications, how many days they are taking the medication, whether they are missing any doses, and this information we can gather. Next one is social history. Social history means smoking or alcoholic status of the patient. Whether the patient is a smoker or alcoholic, how many years he was taking this bad habits is going on, how many cigarettes he will smoke per day. This information can also be collected by proper building a proper relationship with the patient. Diet, whether he was maintaining any diet. Exercise, the patient is non-veg or vegetarian, like this information can be taken. Exercise, in exercise, whether the patient is walking, running, these kinds of information can be collected. History of present illness, whether now what condition the patient is admitted, whether he was admitted for this condition before, is whether he had these kinds of symptoms before, how many days he has the symptoms, from how many days he is suffering from the symptoms. This all information can be gathered. Economic situation, this is more important because in India most people will be poor, rich, moderate, like that. So we will know the unknown, the situation is unknown, right? So we as a pharmacist, we have a role to give a proper medication to the dispensing proper medication which will be safe, effective, and minimal cost, because there will be two kinds of medications. One will be safe, effective and low cost. One will be safe and effective and high cost. For poor people we have to suggest the low cost medications, because we will know right, their financial situation. By knowing that, only we can suggest that kinds of medications. So we have to gather these kinds of medications with the from the patient. Then sources of the information may include, but not limited to, the patient medical charts and reports. Pharmacists conducted health or physical assessment. The patient family or caregiver, insurer, and other healthcare providers, including physician, nurses, mid-level practitioners, and other pharmacists. Sources from where we can, if the patient is bedridden, can't speak, means we can collect this information from the patient caregiver, or caregiver. We can gather the information, and the other healthcare providers, from doctor, physician who is taking care of the patient, nurses we can, and other pharmacists, we can gather the information from these kinds of peoples. Since the information will form the basic for decision, is this kinds of information is the basic for this, for making a great decisions regarding the development and subsequent modification of the drug therapy plan. Yes, for the development and any modification is based on the collected information only. It must be timely, accurate and complete. Yes, we should gather this information timely, fasterly we have to gather the information. Then only based on this we can start the treatment. Accurate is, the information must be correct. There must be no any mistake in that collected information, and the information must be complete. So all the information we have to gather, and it must be organized. As pharmacist has a is a provisional uh, professional course, right? So it we have, if we are doing any work, means it should be organized, done organizedly and recorded to assure that it is readily retrievable and updated as necessary and appropriate. Patient information must be maintained in a confidential manner. We should not share this information to others, because the patient will tell this kinds of information to us in a trusted manner only. So we should not share this kinds of information to others. We can share it to the healthcare providers who is treating the patient, but we should not share this information to others. Okay, next one is patient specific medical information must be evaluated and the drug therapy plan developed mutually with the patient. Yes, the patient says medical information must be evaluated and the drug therapy plan has to be developed. If the patient is accepted only, we can develop the medications based upon the thorough understanding of the patient and his or her condition or disease and its treatment. The pharmacist must, with the patient and with the patient's other healthcare providers as necessary, develop an outcome oriented drug therapy plan. The plan may have various components which address each of the patient's diseases or conditions. Yes, we have to after we collecting this kinds of information, after the thorough understanding of the patient's or the disease condition and its we can modify the treatment by suggesting suggesting modifications to the healthcare providers, because gatherly discuss about that, and we can gradually select the medication drug therapy plan, and we can then suggest the patient's caregiver or patient about this discussion plan. In designing the plan, the pharmacist must carefully consider the psychosocial aspects of the disease as well as the potential relationship between the cost or complexity of the therapy and patient adherence. As one of the patient's advocates, the pharmacist assures the coordination of drug therapy with the patients and other healthcare providers and the patient. Yes, after designing the plan, in designing the plan, how we can design the plan means we can we should understand, the pharmacist and physician must understand the psychosocial of the disease. We should understand the full of the diseases, and then we should know about the cost for this, for the complete cure of the disease, how much cost has to be put in. We know, right, cost of the medication, we should calculate it. Then patient adherence, we should know about the adherence by discussing with the patient. Adherence means the patient, whether the patient will take the medications properly without missing any doses. We should know about this. By taking the proper medications only, we can cure the diseases. Without taking proper medications, when the patient is not taking proper medication, maybe we can't cure, right? So we should know about the patient adherence. If the patient is not taking medication, will not take medication, means we should advise based on that. So we should know about everything on and off of the diseases, plans, everything. In addition, the patient must be apprised of various pros and cons, cost, side effects, different monitoring aspects of the options related to drug therapy, and instances where one option may be more beneficial based on the pharmacist's provisional judgment. Yes. Then the patient must know about the cost of the medications, all the cost of the treatments, side effects, what are the side effects he was going to, he or she was going to go through, different monitoring aspects, what are the ECG, what are the monitoring, different monitoring aspects is going to take instances where one option may be more beneficial based on the patient, yes, pharmacist, based on the pharmacist's judgment, which will be the beneficial option. This all which is a low beneficial option. He should, the pharmacist should discuss about everything to the patient. The essential elements of the plan, including the patient's responsibility, must be carefully and completely explained to the patient. Yes, everything about the plan has to be completely explained to the patient. Information should be provided to the patient at the level the patient will understand. Yes, how, in which level the patient will understood means in that level we have to explain to the patient. The drug therapy plan must be documented in the patient's pharmacy record and communicated to the patient's other healthcare providers as necessary. Then the pharmacist assures that the patient has all supplies, information and knowledge necessary to carry out the drug therapy plan. Now, by discussing the plan to the patient, we will come to know, right? The pharmacist will come to know that whether the patient is has a knowledge necessary to carry down the therapy. That is, the pharmacist provided pharmaceutical care must assume ultimate responsibility for assuring that his or her patient has been able to obtain and is appropriate using any drug and related problems products or equipment called for in the drug-related therapy. The pharmacist must also assure that the patient has a thorough understanding of the disease and the therapy. Yes, in this step, the pharmacist should understand about whether the patient will has the knowledge about a thorough knowledge about the disease and the therapy. Whether the patient has this knowledge or not, he has to come to know about. The pharmacist has to come to know whether the patient has a thorough knowledge about that disease and drug related therapy. Then next step is the pharmacist review, monitors and modify the therapeutic plan as necessary and appropriate in concert with the patient and healthcare team. Yes, in before step, I told that the pharmacist will discuss the thorough thorough knowledge of the disease. They will share the thorough knowledge of the disease to the patient and thorough therapy to the patient. So in this step, the pharmacist will have the ability. They have a ability to change, or they have ability to change the therapy. They can change the therapy because by going through a therapy, if it will we have a plan, right? We will have a plan. In this way only this therapy is going to work in this condition only. But in some people, based on their body's condition, the therapy will change. The effect will be changed. Whether there will be a slow therapeutic outcome will be delayed. In some condition, in this way, the symptoms will cure slowly based on the patient body condition. So we can't judge in the starting. We can't judge in this way only. It is going to work in around 1 month. He will have half symptoms reduced. In this way, we will judge before, but there will be based on the patient condition. They will change. It will change. So the pharmacists have a rights to change the therapy or adjust any dose. By discussing with the healthcare professional, pharmacists can change healthcare professional, pharmacist and patient. We should consider to the patient. After discussing with the patient, he can change the therapy. This is the in this step, this is going to happen. The pharmacist is responsible for monitoring the patient progress. If any changes, any side effects or any improvement, any side effects, any negativeness, positiveness, all has to be monitored by the pharmacist. The pharmacist has to monitor the patient progress. Has to completely monitor the patient progress, achieving the specific outcome according to the strategy development in the drug therapy plan. The pharmacist coordinates changes in the plan with the patient and the patient's other healthcare providers as necessary and appropriate in order to maintain or enhance the safety or effectiveness of the drug therapy. The pharmacist can change the plan is by monitoring the patient situation outcomes. They can change the plan with consideration with the patient and patients are the healthcare providers for improving the safety. If for If using some drugs, some has low side effects, some patients have more side effects. If this patient having more side effects means the pharmacist has to change the medication. So based on the discussing with the other healthcare providers and the patient, they can change the modify the medication for the appropriate safetiness and effective use of the medication. Patient progress is accurately documented in the pharmacy record. Yes, for full progress has to be maintained, recorded in the pharmacist record. The day-to-day progress has to be recorded and communicated to the patient and to the patient's other healthcare providers as appropriate. And we, after recording this, we should communicate this information to the patient and other patients other healthcare providers about this. This we should discuss with the other healthcare providers, share with the other healthcare providers and to the patient. The pharmacist share information with the other healthcare providers as the setting for care and changes, thus helping assure continuity of care as the patient moves between the community setting. Yes, why he should share this information to other healthcare providers means, so just he can get some suggestions, right? The pharmacist will not know entire things about everything, so he can get help from the other healthcare providers. So he should keep some healthcare providers for every doubts, every changes. He should share about the information about every changes, and so that only he can get correct informations from the other healthcare providers. Then practice principles. How this informations are collected, gathered, plan is implemented, everything. Data first one is data collection. The pharmacist contains an initial interview. First of all, pharmacist counseling, right? Counseling means gathering information. Initial interview with the patient for the purpose of establishing a professional working relationship and initiation in the patient's pharmacy record. Yes, first we have to the pharmacist should arrange an interview for providing a relationship, trust between the pharmacist and the patient, and he should gather all the information in that interview and record it in a pharmacy record. In some situations, example pediatric, geriatric, critical care, language barrier, the opportunity to develop a professional relationship with and collect information directly from the patient may not exist. Yes, if the patient is a pediatric patient or geriatric patient, critical care patient, ICU patient, if there is any language barrier means we can't, the pharmacist cannot build a relationship with the patient. Under these circumstances, the pharmacist should work directly with the patient's parent, guardian or principal caregiver. In this condition, the pharmacist can gather the information from the patient's parents, caregiver or any other caregivers. They can gather the information, they can build a proper relationship with them and gather each and every information from the patient caregivers. The interview is organized. Yes, we should, the interview has to be done in an organized manner, professional manner and meets the patient need for confidentiality and privacy. Yes, we should maintain a confidentiality. We should not gather every information and share the information to everyone. We should maintain a confidentiality. We should share this information in a necessary manner only to the other healthcare providers only. We should not share this information to everyone. The confidentiality and privacy of the patient should be maintained. Adequate time is devoted to assure that questions and answers can be fully developed without either party feeling uncomfortable or hurried. Yes. There should be a proper time maintenance for each and every session, for asking the question and gathering the answers. We should maintain a proper time. You should not make them hurry, or we should not slowly conduct the interview. It should be organized. The interview is used to systematically collect patient subjective information and initiate a pharmacy record, which include information and data gathering regarding the patient's general health and activity status, past medical history, medication history, social history, including economic situation, family history, and history of present illnesses. Already, I have said that we should gather the subjective information about the patient status, patient past medical history, medication history, social history, family history. If the family has this kinds of information, this diseases, whether this is genetics or not, history of present illness, everything. The pharmacist uses health or physical assessment techniques, blood pressure monitoring, appropriately and as necessary to acquire necessary patient-specific objective information. We should also gather we should keep the BP vital signs monitoring machines and all, BP blood pressure, then sugar test, everything, so we can instantly gather this accurate information. Then we can also gather the update information, which is vitals and the other kinds of information. The pharmacist uses appropriate secondary sources to supplement the information obtained through the initial patient interview and health or physical assessment. Sources may include, but are not limited to, the patient's medical records and medical reports, the patient's family, and the patient's other healthcare providers. We can also use the by from gathering this kinds of information from the patient or patient caregiver. We can also use secondary opinions from the other healthcare providers. They have also gathered these kinds of informations, right? So we will come to know whether these informations are correct or not. The pharmacist creates a pharmacy record for the patient. Yes, there should be a proper record should be created for the patient and accurate records. The information collected. The pharmacist assures that the patient record is appropriately organized, keep current, and accurately reflects all pharmacist patient insurances. The confidentiality of the information in the record is carefully guarded, and appropriate systems are in place to assure security. Patient identifiable information contained in the record is provided to others only upon authorization of the patient or as required by law. As the confidentiality should be maintained for this record, we should not share these records to others. Only in a necessary condition, after getting a authorization from the patient only, we can share this kinds of records to other healthcare providers. This all comes under the data collection. Then on this next one is information leaflets. The pharmacist evaluates the subject and objective information collected from the patient and other sources, then forms conclusion regarding yes, by collecting the subject and objective information only, he will come to a conclusion about what regarding what are the conclusion means, opportunities to improve and or assure the safety, effectiveness, or economy of current or planned drug therapy. Yes. safe use of the medication, effective use of the, what are the safe medications for this condition, effective medications, economically available, opportunity to minimize current of potential further drug or health related. Yes, by knowing this kinds of information, we can avoid the future or current health related problems, side effects. The timing of any necessary future pharmacist consultation is, if there is any future pharmacist consultation needed, means which time he had to come. These are the conclusion. First one is safe, effective, economic use. Next one is minimize the side effects. Third one is consultation. Next, consultation. The pharmacist record the conclusion of the evaluation in the medical or pharmacy record. He can first he should collect all the information in the pharmacy record. Next, he should also write the information about the conclusion data. The pharmacist discusses the conclusion with the patient as necessary and appropriateness, and assures the appropriate understanding of the nature of the condition or illness and what might be expected with respect to the management. Yes, he should discuss the conclusion with the patient. These are the information leaflet. Then formulating the plan. The pharmacist is concerned with other healthcare providers, identify, evaluate, and then choose the most appropriate actions to improve the. Then he should discuss with the healthcare, other healthcare providers for implementing the plan. Improve, assure the safety. Yes, in this also improving the safety, effectiveness, cost, minimizing the problems. This is the plan. Based on this only, he should develop a plan. Effectiveness, safety, then minimizing the cost, minimizing the potential side effects. The pharmacist formulate plan to effect the desired outcome. The plan may include but not limited to work with the patient as well as with the other healthcare providers to develop a patient-specific drug therapy protocol or to modify prescribed drug therapy, develop and or implement drug therapy monitoring mechanism, recommend nutritional or dietary modification and non-prescription medication or non-drug treatments, refer the patient to an appropriate source of care or institute an existing drug therapy protocol. Yes, he has to, based on the plan only, he should adjust any dietary adjustment needed, means he should suggest that exercise, whether any exercise needed, means he also should suggest that. Then any non-prescription medication he should take, and means he should add, means he should also suggest that. This is the formulating the plan. For each problem identified, the pharmacist actively considers the patient needs and determines the desirable and mutually agreed upon outcome and incorporate these into the plan. The plan may include specific disease states and drug therapy endpoints and monitoring endpoints. The pharmacist review the plan and desirable outcome with the patient and with the patient's other health providers as appropriate. The pharmacist document the plan and desirable outcome in the patient's medical or pharmacy record. Yes, he should formulate the plan. Then he should implement the plan based on the patient. He should discuss with the patient, have the healthcare providers and all. Then he should the formulated plan has to be recorded in the patient record. Implementing the plan. The pharmacist and the patient take the step necessary to implement the plan. The steps may include but not limited to contract and the clarify or modify prescription, initiating drug therapy, educating the patient and caregiver, coordinating the acquisition of medications and related supplies, which might include helping the patient overcome financial barriers of life or lifestyle barriers. Is for implementing plan, the pharmacist and the patient has to work together. He should modify by contacting the other healthcare professional. He can modify or adjust the medications. Then he can help the patient to overcome the life barriers or other financial related barriers. The pharmacist assure the The appropriate mechanisms are in place to assure the proper medication, equipment, supplies are received by the patient timely fashion. Yes, in correct time, the medication has to be given to the patient. In correct time, are there any equipment related checking has to be done to the patient. The pharmacy documents the medical. This all the outcomes has to be monitored and recorded. All the information has to be recorded in a pharmacist records. The pharmacist communicates the elements of the plan to them. Is first he has to communicate the information to the patient. After the patient authorization only, he can give the medications to the patient. Then last one is monitoring and modifying the plant. If any adjustment has to be taken based on the patient condition, means if any changes in the condition of the patient, means he can modify the plan after discussing with the other healthcare providers. He can change the plan based on the patient condition. Okay, these are the pharmaceutical care. In this we have seen the introduction, definition, uh, principle how data are collected, information leaflets, how formulating the plan, implementing, monitoring the plan. These are the informations we've seen in the pharmaceutical care. Thank you.